We all are live now, sir. We can start the event, sir.
Good evening, everyone. On behalf of NASH
Okay.
24/7, I welcome you to our public awareness program on facts you should know about fatty liver. NASH 24/7 aspires to bring best in class education and awareness program to serve healthcare workers, patients, and their caregivers. Today, on the occasion of World Liver Day, we have a renowned gastroenterologist from Jaipur, Dr. C P Tanwar. He needs no introduction, however, I would fail my duty if I don't mention that. Dr. Tanwar is a leading gastro in Jaipur, providing comprehensive and compassionate care to many patients for various gastrointestinal and liver conditions. He has experience building a clinical skill set that allows him to deliver patient centric care. He is currently associated with Fortis Hospital, Jaipur, as a consultant gastroenterologist. Sir, we salute your dedication to spread awareness related to liver health amongst the general public. So now I invite Dr. CP Tanwar to enlighten us on the topic. Over to you, sir.
Thank you for the warm welcome. So, good evening, everyone. So, every year on the 19th April, World Liver Day is observed so as to create awareness about the liver diseases. And because liver diseases are very common, but patients and populations they are generally not aware about the liver diseases. So, I would be just talking in brief about the common health condition of liver, which is fatty liver. Next. So we'll be discussing about the fatty liver. So first of all, what is liver? So liver is the second largest organ of human body, which weighs on an average around 1.5 kgs, with approximately 5% of total fat. And it is located on the upper right hand portion of the abdominal cavity. You can see it on the top of the stomach and the intestines. It is a pink brownish in color, which is having very soft sort of consistency, and it is highly vascular. Next. So, what are the functions of the liver? So, there are many of the functions of the liver. They have plethora of functions. So, it processes the nutrients, it destroys the old RBCs, it regulates the blood composition, it produces bile, it produces cholesterols, proteins, and it controls more than 500 metabolic processes, and it breaks down the alcohol medicines, and it detoxifies the blood. So, because of this plethora of the functions of liver, it is also known as the chemical factory of our body. Next. So, what is the meaning of non-alcoholic fatty liver disease? So, it is a condition in which the fat makes up more than 5% of the liver weight and should not be caused by alcohol use because we are talking about non-alcoholic liver disease. So, if it is left untreated, it can progress into NASH or steatohepatitis. So, if you have overweight or obese, or you have type 2 diabetes or high cholesterol, these are all associated with the raised risk of non-alcoholic fatty liver disease. Next. So as you can see here, that one out of four people they have a non-alcoholic fatty liver disease, regardless of their weight. So it is around 25%. The prevalence is 25%. But if you see this prevalence in diabetic population, you can see that more than six diabetics and in more than nine severely obese patients, they are suffering from non-alcoholic fatty liver disease. So it's very highly prevalent in diabetic and obese. As you can see here, the progression of NAFLD, that how does it progress? You can see that a healthy liver, in which if there is deposition of fat of more than 5% leads to fatty liver, and over the years, out of these population, a significant portion, like 10% of the population, they develop hardness in the liver. The scar tissue forms called as liver fibrosis, and overall cirrhosis, which is a condition in which the liver functions they are hampered and they are not able to work properly. Next, uh, as you can see, what is the difference between non-alcoholic fatty liver and NASH? You can see here in fatty liver there is just an accumulation of fat in the liver, while in case of NASH, the fat accumulation along with inflammation and scarring is seen. So this is called as steatohepatitis. Next. Now, we should look for the causes of this non-alcoholic fatty liver disease. So, if someone is obese, means that is having more weight, or overweight, around high in fried food, only diabetes, syndrome, metabolic symptoms, hypertension, cholesterol. Those who are exposed to such medicines like sodium valproate and a lot of other drugs, and those who are physically inactive, these probably are prone to develop disease. Next, next. So obesity and fatty liver disease, what is the correlation? As I told, that being overweight or obesity causes the fat to get stored in the liver, and obesity increases the amount of fat to constitute 5 to 10%, and which leads to the inflammation in the liver and scarring of the liver. Next. So what is the association between NAFLD and diabetes mellitus? So it is a bidirectional association. Means those who are diabetic, they have a threefold increased risk of NASH and the death due to cirrhosis. And those who have fatty liver, they have also seen to be have a high prevalence of diabetes. And that is around 2 to 4 fold. So you can see that there is a definite bidirectional interaction of the disease. Next. So what are the symptoms of NASH? As you can see here, that majority of the patients they do not have symptoms. If the symptoms are there, just like a mild fatigue, a general weakness, or maybe some discomfort in the right upper quadrant. But if the patient condition is advanced, that is, the patient has NASH with cirrhosis, then there may be a lot of complications. Then complications, there may be in the form of jaundice, that is yellow discoloration. There may be distension of the abdomen. There may be pedal edema, swelling of the feet. There may be a risk of blood in the vomiting or blood in the stool. They may have a weight loss and so on. So these are features of advanced disease. Next. So how do you diagnose it? So see, basically it is a silent killer because the patient is asymptomatic and the progression is very gradual. So how do we diagnose it? Why? Diagnosis is done by blood test, a sonography, a fibroscan, in few cases a liver biopsy, or in some cases a CT scan, an MRI, or an X-ray may also help. Next. Next. So the most common blood tests which we order are SGOT and SGPT. So persistently elevated SGPT or ALT is associated with disease progression. And patients who have normal SGPT levels, they can also develop progressive disease. So up to 80% patients, they can have normal SGPT. There is no designated SGPT or ALT cutoff to predict NASH or advanced fibrosis in an NAFLD patient. So it's very important to go for these tests. Next. There are other blood tests and various scoring methods are available. These methods they have been established to diagnose more better than the SGOT, IGPT alone. There are several online tools which are available from which we can calculate these scores. So as you can see, the non-invasive diagnosis of fatty liver disease. So one important is ultrasound. By ultrasound, we can actually see what is normal liver when it becomes a darkish one, it's fatty liver and then cirrhotic stage. It is easily available, very cheap, and reason for most accidental diagnosis. But the problem is that it only detects when the fat is more than 25%, and it also cannot detect between fat and the hardness of the liver. Next. So what else we want to do? And if you want to get to know about the hardness of the liver, there is a new test which is called as fibroscan or transient elastography. It also diagnoses the fat with NAFLD when the fat is more than 10%. But it also differentiates that whether you have only an increased fat content or you have fibrosis or hardness. It is easy to operate, but the disadvantage is that you cannot do it in obese patients. Then we have this machine liver scan by which we measure LSM, that is the hardness of the liver, and CFP values, which shows the degree of fat in the liver. Now, what are the non-invasive diagnoses of NAFLD? As you can see here, the MRI PDFF is another method which is a gold standard to detect the fat content. It can detect the fat content even when it is more than 1%. And it is widely used in patients who are liver donor patients. But there is a problem that is not widely available and it is very costly one. Next. Another one is the liver biopsy. Definitely, it is a gold standard method. You just need to take a piece of liver cells and it rule out other liver disease. But the problem is it is painful. It depends on the individual, and the chances of misdiagnosis are there in the early stages. Next. So progression of fatty liver takes years. So if you intervene early, it will always be beneficial. As you can see here, those who have fatty liver, 70 to 75% patients, they may have just an isolated fatty liver and it doesn't progress. But those who have fatty liver with mild inflammation, so in those population, you see here, they can convert into NASH or steatohepatitis. And around 20-25% patients, it directly goes into this state. And out of them, 11% of the approximately population over 5 years, they develop hardness in the liver, and that is called as cirrhosis. And out of them, 7% they develop SCC over 8.5 years, and 19 to 45% they develop decompensation. Next. So you need to act before it's too late. So NASH is a more serious form of fatty liver disease. So and NASH will lead to the cirrhosis or liver cancer, and severe NASH is not reversible. So we have to act early. Next. So what we can do? We have to improve the diet, more of fruits, vegetables, grain, and lean meat. A diet high in protein, nutrient rich should be followed. Daily aerobic or anaerobic exercises like swimming, walking, jogging, they can be included. Lifestyle modifications, that is, curtail the intake of alcohol and smoking. And there are certain new medicines are also available which reverses this condition. Next. So control your weight gain. So a combination of a diet which is low in calories with moderate intensity exercise provide the best likelihood to sustain the weight loss. If you can sustain it around 3 to 5% body weight, it helps in improving the fat content, and 7 to 10% of the weight loss. It improves the majority of the features of steatohepatitis or the inflammation or fibrosis. Next. As you can see to this pyramid, a weight loss of more than 3% reduces the fat. A weight loss of more than or equals to 5% reduces the inflammation. A weight loss of more than 7% resolution leads to resolution of NASH. And more than 10% they leads to the resolution of fibrosis in 45%. So it's very important to have a good weight loss. Next. So what it should be the diet? A diet for healthy liver should be around Mediterranean diet. As you can see, every day you should eat. Your diet should be around vegetables, fruits, whole wheat, grains, the good source of fat like olive oils. Then you can eat beans, nuts, legumes, seeds, herbs, and spices. And often you can eat twice a week, like fish and seafood. But weekly you can take moderate portions of poultry, eggs, cheese, and yogurt. And less often you should eat red meat and sweets. Next. So aerobic exercises and resistance exercises. Aerobic exercises reduces the liver fat, maintains a healthy weight, improves the cardiovascular conditioning, while resistance exercises reduces the inflammation, improves the glucose and insulin sensitivity, and improves the metabolic parameters with less energy consumption. As you can see here, both of them they can lead to the normal liver in fatty liver population. Next. So lifestyle tips to tackle the NAFL or NASH, develop an exercise routine, stick to it, get enough sleep, get enough vitamins and minerals, go for regular medical checkups, eat small frequent meals, and lower down your sugar intake. Next. So there are medicines available nowadays like pioglitazone, which acts on both diabetic, non-diabetic, and should be given for 2 year duration. Another drug is saroglitazar, NASH with or without fibrosis, both diabetic, non-diabetic, around 1 year, and vitamin E, but it is used in only non-diabetic adults and pediatric patients. Those should be used for around 2 years. Next. So the tips to prevent fatty liver disease is limit the intake of saturated fats, trans fats, eat a balanced diet, limit the consumption of refined carbohydrates, maintain a healthy weight, quit smoking, exercise regularly, limit or avoid alcohol, and take the medications as prescribed. Next. So if you have any questions regarding to the fatty liver disease or this NASH or fibrosis, you can actually ask me now.
Thank you so much, sir, for this wonderful talk, and this was really enlightening talk. So we have some questions from the audience.
Yes, sir.
So the question that we have is, Does liver 52 has any role to play in NAFLD and NASH?
See, basically, in all those population, I would just like to tell you one thing. So it can help you if you have a severe disease or if you have severe NASH. Then there are certain other medicines which are available, and there are other measures which we can try. So this is you can take Leave 52, but it has only a supportive role, and it should be undertaken taken under the medical supervision. On
Yes, thank you, sir. And the second question that we have is, does smoking cause fatty liver?
so smoking per se does not cause fatty liver, although a few studies they suggest that it might cause some in some population fatty liver, but definitely alcohol smoking is a risk factor for fatty liver disease.
Right. So, thank you so much, sir, for this wonderful and enlightening talk. So, on behalf of Nash
Thank you.
24/7, I thank Dr. CP Tanwar for this lively and informative talk. As you have been emphasizing the awareness for liver health and disease, it is equally important for people affected by fatty liver to regularly visit doctor and continue their medication. With
Yes,
careful
correct.
observation and precautions, it is possible to obtain control of the disease. I would like to thank our audience also for their active participation and patience in making this event successful. Stay
Yeah.
connected with Nest 24/7 on Facebook and take care of yourself and your family members. Thank you. Thank you, sir. Thank you.
Thank you. Thank you. Thank you.